Welcome back, everybody. Thank you so much to all of our speakers for those presentations. Really, really interesting stuff. And thank you to those of you who sent through questions for us. We're going to start to get stuck into those, but please do keep on sending them through if there's any things that occur to you as we're talking. Before we get started on the questions, I just wanted to allow Kim to introduce herself. She was not on the pre-recorded video. So, Kim.
Hi everyone, I'm Kim Adams. I'm the Programme Director for Local Care Partnership Development and have been working alongside Rachel and George on the Seacroft Local Care Partnership project.
Thank you, Kim. And I just wanted to start off because we had two great examples from Leeds in this section, and both mentioned the work that you are doing in Seacroft, but different work with different bits of the community. So I just wondered, Kim, if you could give us a few words on how those relate and how that work is going in Leeds.
Yeah, absolutely. I think one of the aspirations for us around local care partnerships has always been that communities are absolutely at the heart of it, and that local people have got their own voice within that local care partnership. So the work we presented in Seacroft is a really good example of that, but actually to get to people across the community to work in partnership with the community, then organisations such as the LS14 Trust and the asset-based community work is absolutely vital for us to be able to build those connections and really strengthen our links with local communities. So there's a really great fit there, and we're busy exploring how we make that something that we're taking across all of the partnerships in the city.
Great, thanks, Kim. So for our first question, it's the most popular question, was about, it's from Sue Jordan. Could you tell me more about the signs of improved health and well-being, please? And this was relating to the first presentation that we had, Verity and Jenny. So could you tell us a bit more about that?
Yes. It wasn't an outcome we were specifically measuring, but during conversations during the fieldwork, what emerged quite a lot is a lot of individuals were talking about feeling more confident, having higher self-esteem, having more purpose in their life, feeling more valued, and that was really what we're alluding to there. It was largely qualitative evidence, it wasn't measured quantitatively. A brief example, a man called Martin, who was coming to a food bank to receive aid. He got chatting to one of the community builders, and he then she suggested he started volunteering, which he did. He really enjoyed it. He met people. He then started talking about how he really loved cooking, and there was an underutilised kitchen in a sort of shared accommodation where he lived. So a Small Sparks grant was given to him to sort of get the oven working again, and he started cooking for the 10 people in this shared accommodation. And that had really led to him having more friends, more connections, and feeling like he had a sense of purpose, and his confidence really raised. So that's really what we're alluding to. There were some stories about people using health services less, but I'd say that was less of a dominant theme and not something we specifically looked for.
Great, thanks, Jenny. And this links to the question that Marie sent in for George, who isn't here, but Rachel and Kim are, about the evidence of the impact of the programme. So, Rachel, are you able to talk about that?
Yes, of course. Thank you for the question. I think it's a really interesting one, and one that we're consistently challenging ourselves with within the Seacroft LCP. So we're very aspirational in our approach in Seacroft. And in terms of evaluation, we're really wanting to look to use data to evidence impact. So we do have an evaluation programme underway, looking at some 3 main areas. So looking at increasing knowledge and awareness around domestic violence and abuse, looking at increased confidence when dealing with disclosure of domestic abuse, and enabling the community to be advocates, In terms of measuring success, we've got some quantitative measures and metrics. So, for example, the number of people who are being trained, in terms of their level of confidence, looking also in terms of the number and variety of safe spaces. But actually now we're reflecting, are we being tough on ourselves? And actually, is it the impact on local people and whether they think that we're making a difference? That actually is the main thing around how we evaluate success. So looking at those really rich reflections and stories, what is the experience of people living in the area, and really those qualitative tools. I think we're quite fortunate to have a culture in Leeds where we're really encouraged to test out new ways of working. So we've got absolutely loads of learning, whereas we might not have that formal evaluation yet. We've got the learning that would enable us to replicate this domestic abuse project across Leeds. Yeah, I'll leave it to colleagues to really give some feedback in terms of, are we doing enough in terms of evaluation?
Yeah, thanks, Rachel. And Verity, you did an evaluation for your project as well. How are you measuring the impact?
Well, parts of those measurements of impact was stuff that we'd commissioned Leeds Beckett University to do, which obviously Jenny had highlighted in the evaluation itself. But we were, as Rachel was just saying, in Leeds, we are quite lucky in the fact that in the council we can sort of try new ways of looking at qualitative impacts instead of quantitative, so much as we find so much in health, really. So Jenny's highlighted how we did that. It was through raised confidence, raised reports of raised well-being, and also that sense of purpose and connectivity to people in their communities.
Yeah. And Jenny P, too many Jennies in this session. Yeah. We're for your project, there was a lot of evaluation involved in that. How are you measuring the impact of that? How does that relate to how the colleagues from Leeds were doing theirs?
So the Neighbourhood Resilience Programme was part of an NIHR funded collaboration. They're called CLARCs. Some of the people listening may know them, but which meant we did have quite a strong evaluation framework. So we had a household survey in the neighbourhoods, plus some control neighbourhoods where we didn't work. And that was done two rounds of that so far, and there may be a third coming. And then we did qualitative interviews and focus groups with different system players, so with local authority staff, the third sector staff, people working in the Community Research and Engagement Network, the COREN, that we described, and with residents, particularly the residents who were recruited. We call them resident advisors to the programme. And so we have longitudinal quant data and qualitative data. And I think it's really important. I don't know about the Leeds projects, but the Neighbourhood Resilience Programme was started just as austerity hit, and it had a dramatic effect on public services in these neighbourhoods and in the local authority teams, for example, in particular, with one team dropping from 14 members to 2 members over the first couple of years of it. So we weren't expecting to find, and of course the people living in these neighbourhoods were dramatically affected by austerity, by the reduction in services, the benefit restrictions, etc. So we didn't expect to find positive health and well-being impacts at a population level, and we didn't. We didn't actually find negative impacts, which is amazing. But what we did find was, as people have said already, extensive improvements in connectivity across the system, not just the community, between the community and between agencies, and between the agencies and the communities. We got, at a population level, one of the findings which was really interesting for us was people were reporting much more influence over local decisions. And that was at the population level, not just the residents that were most engaged. And there were comments about reducing the negative image of the place and the kinds of things other people have been talking about. So I think some clear evidence that this system, neighbourhood system, which I think is what other people are saying, is impacting on the pathway to improved health and well-being, even if we can't evidence actual health and well-being outcome improvements.
Can I just add something about the ABCD evaluation in terms of, I just felt we were a little saying we only got qualitative evidence. I don't want that to come across like that, because I think we did design it that way, that we really wanted to collect. We wanted it to be sort of collect rich stories really and in-depth data. So we had a number of different arms to the evaluation. So the sites did collect monitoring data, for example, via Verity's team, and we did walks in the community. We also encouraged the sites to do their self-evaluation as well. So we held training workshops for the sites, and we got some really lovely stories and from the community builders that way. And even one community builder had done a lovely map of all the connections that someone had made, and so we did have a variety of data, and really we saw our role to sort of bring that all together and measure the strength of the evidence. That was our approach on this particular project. And that was the steer from the council sort of early on.
I think there's quite a lot of challenges in evaluating these kinds of projects, isn't there? I think we'd probably all agree that. I mean, one of the things that the Neighbourhood Resilience Programme was very explicit about was focusing on what people refer to as upstream drivers of health inequalities. So these systems that we were working with focused on, for example, air pollution, employment opportunities, debt. And whilst at the moment we can't evidence of definitive improvements in employment, in air pollution and in debt, the fact that they were working on those is key, is also a part of this pathway to improved health inequalities. So I think there's probably some thinking about how we better evaluate. I was really fascinated by the social, the economic kind of arguments that were being made in one of the Leeds projects, because I think that kind of approach is really important.
Yeah, that's the SROI value. Yes, that we tried. Yeah, we tried to do. Yeah, we did do. We trialed it in one area. Yeah.
Both of you, very comprehensive answers. I feel like we could have a whole conference just talking about the evidence and evaluation and impact. You mentioned briefly there, Jenny W, about the forum for builders, and we've got a question from Thomas about whether the connectors attend that as well. Did they have their own forum, and what training they received?
Can I pass that question to Verity, because she's more in touch with that area? Is that okay?
Of course.
Yeah, of course. I suppose the answer to Tom's question is that it's not that formalised process. So we have very sort of loose outcomes in our monitoring. It's really about being an ABCD purist in that sense, and being, it's that organicness of communities and neighbourhoods and how they would like the model, if you will. We conceptualise it as a council, but we don't own it in that sense. The money's given to the third sector organisation. We ask them to employ the builder, as I said earlier on in my presentation, but then they find the connectors. But these are long-standing members and residents in those communities that are experts of their own communities. So to formalise that process, to say we would then offer you training, or you attend a network meeting that we would run as a council, is not something we would look to do. It would be more if those connectors, or a big thing that did come out of the evaluation actually is the use of language, how we label people given these terminologies and that was a big thing that we're looking at as a council. Do we not use this language with communities? Why are we trying to formalise what that looks like? So I'd say we ask builders, do the connectors get together? Does that work for your area? If it doesn't, then that's okay as well. We are looking at the way we might better support neighbourhoods, and we're doing some consultation around an area to do with training. But we believe that the experts who are the connectors in communities don't need training to be a connector. They're doing it in an organic way. COVID showed that. The reciprocity of communities and neighbourhoods showed that. They are those community connectors. Hope that answers the question.
Yes, great. Thank you, Verity. Rachel and Kim, can you talk about any training that took place in your project for the people who were working with working in the field of domestic abuse? Can you talk about that for a while?
Yeah, so certainly I can talk about the domestic abuse community ambassadors training. So that's for residents and local community members. And I think the beauty of this is actually we're co-designing what the training should look like with local community members. So very much a bottom-up approach, but working with the experts in the Safer Leeds Domestic Abuse Service to provide this sort of free training. So that will be really ongoing support that will help community members really to start conversations around abuse, to know where help is available, to share their knowledge with others, and know how to give that supportive, helpful response if anybody shares that experience. But what I think also is helpful is that group is going to come together as a peer group to support each other. It's not an easy topic to speak about or to tackle, and really ensure that those people have that sort of supervision, a chance to debrief, and really sort of keep their resilience up, acknowledging the important work that they're doing. And then also residents joined in with a programme of training in terms of identifying gaps in knowledge, and that was all partners across the local care partnership. So GPs, colleagues from primary care, community healthcare, housing, schools, police, together with local community members. They all learned together around different topics. And I think really it was the first chance to really discover what each partner brings to the table and where they're coming from. So I think doing that collective training was really important, and that evaluated really well. So I think we'll continue that approach with training in the future. So doing it as that one team Seacroft.
Yeah. And Linda, I know that there was some training in your projects as well. Can you talk about that, the neighbourhood level training?
Yes, so we had training both for our facilitators of the Community Research and Engagement Network, and for our residents that, as Jenny's just said, we call resident advisors, taking on board. Let's not label them too much, let's just call them residents. At the beginning, we thought that we would have a training package that all of the residents could take part in, but that wasn't taken up that well. But so in a way, we really reacted to what residents required for training and put in the training that they requested. Some of it was around how to be an equal player in this system. So how to around influencing, how to have their voice to be heard in, and we're too used to having structured meetings, and perhaps that's not the best way, but how can they really engage in representing their neighbourhood in a room with people that perhaps they're not used to always conversing with. There was other training, I think we spoke about that we had resident-led inquiries. So that was some very training for the actual carrying out the research. So different residents were perhaps collecting data or analysing it, or what does consent mean, and just some very basic training so that they could carry out the inquiries themselves. But we also had a network where they all came together, which was the Corin, and that brought together these facilitators, which I think are probably similar to your builders in the other programme. And that was to bring them together so that they could have training in a topic that they wanted to collectively. But I think basically we reacted to what came up during the 4 years of what training do they need, do people need across not just residents, current facilitators, people in the council, people in other third sector organisations across the system. What training would be beneficial for them to make this work even better?
Thank you, Linda. So we're coming up to the end of our time, but I just wanted to ask a question that was submitted by Mandy, and it was referring to the first of our presentations today about what helps to create a culture of permission, but it also relates to what you've all been talking about around how do we keep that balance between using our community assets, having an asset-based approach, but not withdrawing support from those communities, not leaving them to do things on their own. So Jenny W, I don't know if you wanted to talk first about what you were referencing in your presentation.
Yeah, in relation to the letter point, that question, I had a nice quote, because I mean, we all need to, inequalities do exist and services are needed, and we do need to acknowledge that. But so this is a quote from a senior manager who said, ABCD never said you don't need services, but what it says is, first and foremost, start with your community and your neighbours, then look at what you can do via the social sector, and only then look at what you need a formal service to do. So for me, that it's complementary, it's not instead of other support. I'll leave it there.
Kim, did you have anything that you needed, or Rachel, on that?
Yeah, building on that, Caroline, we have something that we use with each of our local care partnerships when they're shaping new work. So we ask them to think about what will be done by local people, what will be done by local people with support, and what will be done by organisations working with local people. So it's, again, that same approach really of starting with people first, but acknowledging that there will be some things it's absolutely appropriate for organisations to do, but that should be with communities.
Great, thanks, Kim. And Jenny P, on your presentation, because you talked eloquently on this point about resilience.
Yes, I mean, we've not got the time to go into it, but I think that what the neighbourhood resilience thing was trying to do was say, not to start with communities, actually, and I know it's difficult, and I'm leaving it there without being able to explain it, but to start with the system. And so I would turn those three questions around and say, what do communities think organisations should be doing? What do they think the public sector should be doing? What do they think the private sector should be doing? And then think about, well, what do we want to do ourselves, really? Because I think there's a real danger of this work all being in the most disadvantaged communities, and language is really important. And I think that the way it's sometimes perceived is that this is for us to do, and we'll do it with you, but it's for us to do. And I appreciate it's a big issue, this.
Great, thanks, Jenny. We've run out of time in this session, I'm afraid, but thank you all for watching. Thank you to our speakers for taking part. You can all watch this session back again on demand, just like you can all of the sessions that we've had this week. But you've got a half an hour break now to just take a break from your screen, you can go and download resources and visit the exhibition stands. This is also your last chance to get any more points in the leadership challenge, as we will be announcing the winner of that at the end of the next session. But for now, we've got a short break, and we'll see you in the next session, which starts at 11:15.